we would like to go ahead and make introductions now for our mental well-being in the workplace, minding the gender gap fireside chat. And so I'm going to kind of just explain how this session will go. Really excited to introduce Mim Sams, CEO for Global Women for Wellbeing, and our CEO and President, Renee Marie Stefano, with Corporate Health and Wellness Association. And then also leading the panel discussion will be Allison Crouch, who is Head of Client Partnership for Thrive Global. And then following the broad-based discussion with these three ladies, we'll welcome panelist Lynette Davis. She's Business Manager for Women, author, and mental health advocate with LynetteDavis.biz. Also, we have Kimberly Shambly, who is the Director of Human Resources for the Chicago Teachers Pension Fund. And of course, Jen Fisher's with us, Chief Wellbeing Officer with Deloitte. So without further ado, I'd like to have Allison go ahead and start the fireside chat out with Mim and Renee, and then continue on to ask the questions of the panel.
Perfect. Well, first and foremost, thank you so much for including me in this. I'm so excited to be part of this and to learn from you all. So without further ado, I'd like to start, Mim. How does Global Women for Wellbeing shine the spotlight on gender equity? In particular, looking at diversity, inclusion, and how all of this relates to women and mental health.
Well, thank you. First, it's a pleasure to be here. And this is obviously a deep passion of mine. Coming from the corporate environment, working in the corporate world for many, many years, it became clear to me over the years that there is a big disconnect between our discussion about how we have true gender equity in the workplace and what actually is playing out in the numbers. And so there were a group of us that got together at an event at Harvard's Public School of Health and said, what are we missing here? There are amazing organizations out there that have done great work and continue to do great work, but the numbers at the top for women in leadership in every profession have not changed. And so that led us to producing the white paper, which I'm very grateful for making it available to everybody, to take a deeper dive into the connection between the unique women's health and well-being challenges that are out there for us, what has been studied, where the gaps are, and how that connects to the way we are able to lead, but also how women are seen as leaders. And we look at that not just through the gender lens, but also through the diversity lens, because often when we talk about gender equity, we don't highlight enough that for women of diversity, they also have unique challenges. It is even tougher for them. And so we've gone down this path of creating quality research that gets turned into real action steps. And I think anybody in the corporate environment understands what I'm saying. Research is great, but if you can't apply it practically, we can't move this forward. And then sharing that with leaders from a variety of backgrounds so that we can start to accelerate positive change.
That's really interesting. I'll sidebar, I don't know if you all read the article in the New York Times about the gender gap. I still can't get over that, and my children are a little older, but every time I think about who's in charge of buying the birthday present, that article comes back to mind, and maybe we can share that later if it's something people are interested in. Another question for Renee. As a leader, in what ways does the Corporate Health and Wellness Association contribute to the conversation around women leaders in the workplace?
Well, I love what Mim was saying about, how this evolved for them, because it happened similarly for us. When we started the Corporate Health and Wellness Association about 10 years ago, everybody was talking about wellness programs and cost reduction strategies, and it had nothing really to do with individuals other than fitness and nutrition. And when we started to see, everyone's getting disenchanted because the results weren't there, you start diving into why is this happening. These issues like gender inequality, the reality that people have to be happy at work, they have to feel like they have opportunity, they have to feel like that, they have to feel appreciated, they have to have financial well-being, and the industry itself evolved tremendously into more of the well-being factors and the individuals that make up these companies. And for me, it was exciting because I was also going through my own personal transformation and looking at how all of these things in my own life apply to how I become a successful businesswoman and how businesses generally become successful. So our focus has been to really look at what works and what doesn't work in the workplace. So instead of pontificating at that higher level of what should work, we've dedicated our time to bringing in employers and professionals that are implementing this and looking at how culture really is, looking at the culture and changing the culture is what's required to make this change. And so our educational programs are really focused on case studies and, the experiences with the employers, the experience with the HR executive, as well as the providers and the consultants that are working with the employers to implement that. So our training and certification programs, our e-learning and continuing education is really focused on that, the case studies, and sifting through the white noise to get at what really is working out there. And what we're finding is similar to what a lot of what MIM is talking about in their report. It's, for all of us, in order for us to be happy, we really have to be happy at work, and what makes people happy and what makes them up to the core. What is the core belief system? How do you, as an employer, help support that core belief system? And all of those areas, I think that's what needs to continue to evolve. And the gender gap is a huge part of that. Our ability to feel like we can rise. How do we rise? How do we go about rising? What are the opportunities that are available to us? And how do we, as leaders, make sure that we are not only creating the programs, but holding managers and leadership accountable at all stages to, across the board, to make sure that we are doing that. And even for myself, just recognizing my own personal biases, that started many years ago, and holding myself accountable for those biases, recognizing that and being able to implement change at an organizational level based on better understanding of myself.
I love that you talked about the need for people to be happy at work. At Thrive Global, our founder, Ariana Huffington, never uses the word work-life balance because she feels like that indicates that, there's two sides and we're only one human and there's only one place that we can be. So I think that's a powerful statement. So another question for both Mim and Renee. Can you guys share some background on the progress you've seen from the perspective of leadership equity, and what you would say are some of the ways that organizations can make strides for better programs for women?
Great. Renee, would you like me to start?
Sure.
Yeah, I think it starts with, something that you just spoke about, Allison. It's really understanding the spoken and unspoken biases that are in the workplace. And like it or not, the workplace is still pretty much designed from a male perspective, and it's nobody's fault. It's not finger pointing. It's just recognizing that a lot of the barriers that are there really don't support where many working women are. So starting with a real evaluation, and it is about the numbers. There are tons of organizations that have great women's affinity groups. But again, if it's not playing out at the top of your organization, if you've had a women's affinity group for 10 or 15 or 20 years, whatever it is, and those numbers at the top haven't budged, then I think the organization has to take a good hard look at what they're doing and say, okay, we're missing something here. Again, it's not blame, but there is, I've heard the term pink washing out there, and we've done this great thing, but then you go look at the pictures of the people on their board, their C-suite, that level right underneath the C-suite, and it just doesn't play out. And so I think you have to have an honest discussion about where you are. And to your point, it isn't just about, are we going to teach women how to negotiate in a better way? Are we going to make sure that they're in a mentoring program? There's a bigger picture around this. We are whole beings. And so those issues around caregiving, whether it's for children and or parents, the impact of pay equity, which there's very solid research that shows that pay equity actually impacts mental health and well-being for women in the workplace, that it's more of an ecosystem of how you start to design what you want to do. And I think we all know this, it also has to be culturally specific. What works in one organization doesn't necessarily mean it's going to work in another, but I will tell you that it can be done. It's great in Florida called Meteor Education. In 4 years, 4 years, they went from having no female leadership in their C-suite to now having 40%.
Wow.
So yeah, it can be done. It does take a leadership buy-in and real intention and strategy around it. But the gains that they've had in terms of attracting and retaining talent, like it's played out in the way that it should have, and they have the numbers to prove it.
That's fantastic. Renee?
Yeah, I think we've made tremendous progress in the workplace in as much as if you look at some of the numbers, there was a study done, leanin.org did a study with McKinsey that said, I think it was over 4 years and over 400 companies that they looked at. The number of women, like in terms of senior leadership, 1 in 5 are women, 1 in 25 are women of color. I mean, those numbers are still low, but the reality is that even now, there's more women getting bachelor's degrees than men. So why is it that you don't see them in senior leadership positions? We see them asking for promotions. We see them negotiating better salaries, and they're not leaving the workforce as much, whether it's to raise their family or for any other reason. So why do these numbers exist? And even, I think, more surprising to me was to see, like, on a global scale, the small number of really prominent women, the big gap between the small number of prominent women and the majority of the rest of the women that are not prominent are found in Fortune 500 companies, for example. If you look at, I was previously a lawyer. One of the reasons I left the practice of law, I saw that 45% of the associates in the legal field are women, but only like 19% get to be equity partners or 20% get to be senior partners, and yet we all would have to work our butts off, night and day to get the job done. And to me, that wasn't promising. And the same thing in the financial sector. There's even a higher percentage, over 60% of people that are accountants and auditors, financial managers, but only like 12% end up as CFOs of Fortune 500 companies. So I think that I think that a lot of the problem is that there's not a true commitment in the hiring process, in the promotional process, and the mentorship to be able to support women in the workplace. And then there's no accountability, like I was mentioning before, to really hold the managers and hold leadership responsible for actual data-driven results.
Mm-hmm.
I agree. Jenny, I'm not sure if you want, I'm just trying to be cognizant of time, if you want us to keep on this topic or if you wanted to segue to the next part of the panel.
Thank you very much for asking. Yeah, I think this has been really a robust conversation. Thank you so much, Renee and Mim. Renee, I know, has another meeting, but Mim, I'd love for you to stick around and then we'll continue the discussion. And Renee, thank you so much for taking the time to lend your leadership ear. It's great to have a CEO who is a leader, a female, and a strong advocate for us here at Global Healthcare Resources and Corporate Health and Wellness Association. So thank you for your time. And again, we'll go ahead and carry on with the conversation. Thank you.
Thanks.
So are we, Jenny, are we adding more people?
So we have Lynette Davis, who's already joined us, and Lynette is business manager for women. She's an author, a mental health advocate, and a blogger for LynetteDavis.biz. We also have Kimberly Shamley. She's the Director of Human Resources for the Chicago Teachers Pension Fund. And finally, we have Jennifer Fisher, who joins us as the Chief Wellbeing Officer for Deloitte. And so thank you guys all so much for joining the conversation, and we will continue this topic on minding the gender gap.
Perfect. As someone that lives in New York, I love the mind the gap. It reminds me of every day getting on the train or trying not to fall into the subway. Also, just a little housekeeping. Kimberly does not have camera, so if you can't see her, you will hear her. So that's just fun to know. But we will start with you, Jen. Can you talk a little bit about Deloitte's paid family leave and the impact for women and men in the workplace?
Yeah, absolutely. So I'll take us on a little bit of a journey here, but going back about probably 2.5 years. We announced our paid family leave program in September of 2016, and leading up to that, and really what kind of led us to enhance our program in the way that we did was a number of things. We've always had market leading benefits that we're really proud of for both our women and our men, and otherwise, quite frankly, really for everybody. But leading up to that, we had looked at the market, kind of saw what was going on, understanding where we as a nation are, and our public policy around, or lack of public policy around, paid family leave, maternity, paternity leave, and just feedback from our people in terms of what mattered to them, and the changing dynamic of the workforce and the definition of what a family is, and really wanting to appeal and apply to all of our employee base at Deloitte that is qualified for this benefit. And so what the benefit is 16 weeks of fully paid family leave, and it's caregiving leave. So it's for bringing a new child into the world, whether you're the mother or the father, adopting a child, as well as any caregiving for a sick family member, be that the unfortunate sickness of a child, a spouse, a mother, father, sister, brother, and it's 16 weeks in any given year, and so it does renew each year. We're really proud of it. It is market leading, and our hope is to help to lead the conversation on paid family leave, not only in corporate America, but certainly we hope that many in corporate America may not go as far as 16 weeks like we did, but will look at their family leave program and evolve it to address some of the changing dynamics of the workforce. We now have the sandwich generation in our workforce. We have 4 generations actually in our workforce, and really being there for them throughout their life's journey, we believe is really important, but really also to lead the conversation as to where we are, as a country, and perhaps lead that from the private sector, and what we can do and what we should do more for not only our women in the workplace, but for everybody in the workplace.
That's fantastic. I certainly wish I would have worked at Deloitte when I had 3 boys in 3.5 years. That is really amazing. Whenever I'm in Europe, I think to myself, if I had lived there when I had my kids, I could have been at home until my youngest was 5, between me and my husband, the way we stacked them up. So you guys are taking like such an amazing step. That's something to be super proud of.
Thank you.
So, Lynn, how do mental health and well-being issues affect women in the workplace, in your opinion?
Sure. So, you know what? I like to think of this as twofold. On one side, there are women in the workplace who are dealing with mental health issues, who have probably a diagnosable mental health disorder, such as clinical depression or anxiety or bipolar. And on the other side are women in the workplace who are dealing with family or a spouse or children who are having and dealing with mental health issues. So they might be, in worst case scenario, even a survivor of a child or a relative or a friend or a colleague who has died by suicide. So there's 2 sides to look at with that. So I'll talk about the side of the survivor, because a lot of people find that one a little bit easier to deal with when we're talking about mental health in the workplace. And the reason why is because it's easier to say, oh, yes, I know somebody who's dealing with something, rather than to admit that you have a mental health disorder. And the reason why is because there's still so much stigma just regularly in regular life, as well as in the workplace. So on the side of you're a survivor of somebody from who has who has died by suicide, or who struggles with mental health disorder, one of the things that we don't realize is that it also affects us. One of the reasons that it affects us is because sometimes we have things like guilt or shame around being associated with different mental health disorders. And that translates into things like bullying behavior or passive aggressive behavior in the workplace. For example, with my previous company, A&D Media, we were a partnership. And one of the reasons why our partnership dissolved is because my business partner had to check herself into a mental health hospital as she was contemplating and actually went on to carry out the act of dying by suicide, but she did not fully go through her suicide, which is about right for women. Women attempt suicide way more than men do. Men successfully complete suicide more, and that's because they use more lethal measures to do so, but women attempt suicide more than men. So having a partner who's doing that, and I'm working closely with this person, the first and natural thing, because we're human and we go back to ourselves, is what did I do? What did I miss that I couldn't prevent such a thing from happening? How could I have helped her more? And just feeling a lot of guilt and shame around that. The other side of it is how that affects you if you also have a mental health disorder or issue. So it triggers you and your mental health disorders when other things are happening. You can see that in things like movements like the Me Too movement, where a lot of women and men are finally coming out about different things that have caused trauma in their lives. But for some people, it's really traumatizing because it's bringing back old memories, because there's so many stories that are so similar to them and circumstances that are so familiar to them that is taking them back into that time that they might not have addressed, or they didn't want to really deal with, or they never sought help for. So while we're all dealing with these different issues, we're also taking these issues into the workplace with us. And the truth is, statistically speaking, depression is one of the leading causes of disability in the workplace right now. And we still have a long way to go when it comes to addressing mental health in the workplace. And one of the main things that I would say that we need to do is start with education. If you look to I'm trying to say it right because I always say AFSP, but American Foundation of Suicide Prevention, they have a set of core measures to help with suicide prevention. And one of the main things that they talk about is policy promotion, which, as somebody mentioned, it starts from leadership buy-in, or otherwise it will not work, as well as educational programs. And those educational programs could be something as simple as a free program such as mental health first aid. For certain nonprofit organizations, they have to take first aid classes in order to even work with a certain population. Can we become at a point in our culture, in our society, to make it something that, since this is a risk in our workplaces, why not make it a requirement for employers and employees to take classes such as mental health first aid, so that we can recognize the signs and be able to work through things so that we could help people who are dealing with mental health issues, as well as prevent suicide and the aftermath of that. So those are some of the things that I would say we can begin to talk more about to help take this conversation to another level in the workplace when it comes to mental health and women especially.
I agree, and there's a lot there. I think before we move on, is there anybody else that wants to talk to this topic, or potentially, react to the need or the desire to have requirements for mental health programs in place for employers?
Yeah, so this is Jen, and I completely agree with everything that Lynette said. Allison, as you know, this month, May, is Mental Health Awareness Month, and Deloitte has launched a pretty significant campaign around mental health awareness internally for our employees, knowing that 1 in 5 adults will suffer a mental health condition in their lifetime or in any given year. It's somebody we know if it's not ourselves, and that impacts the way that people show up at work. It impacts the way that they treat one another. It impacts the way that they serve our clients, and it certainly impacts their own impression and views of themselves. There's a lot of fear that comes along with the admission of struggling with a mental health condition and seeking the appropriate help because of the stigmas that exist. And so one of the things that we have done, and there's been several that have gone along with this campaign, but completely agree with Lynette, is that we I've been working with an organization to roll out mental health first aid and make it available to all of our people at Deloitte that are interested in taking it. And with certain populations within Deloitte, it's a requirement that they take it based on their job and kind of the requirements of their job. And so it's something that we believe strongly in as well.
Yeah, and I would say kudos to Deloitte for all you're doing. It really is amazing, and you truly are a leader. So thank you for sharing that. For any of you that know the folks at Google, they implemented the Blue Dot program, which has been very effective for them. And just quickly, they trained people internally. They trained people that were the go-to people, which I think is really important. It's not so much, it's great to put it in management training, but you want the people that already have emotional awareness or intelligence to be part of the solution. And so they did a very good job of identifying them, training them, and then they wear a blue dot on their ID so that anybody can approach these folks and they are trained to get them to the right resource. They're not a mental health professional, that's not what it's for, but it's to bridge in a meaningful way, in a way that makes it easier for people to go get help from people that they trust. So you're seeing more of those types of things. I know Zappos did an amazing job internally as well when they changed their culture, which was such a positive thing, which is kind of the reverse of this, but they were kind of shocked that that kind of change would cause the kind of stress that it did in their organization. And so they, to the leadership's credit, they stood up and said, all right, we misjudged this. We own it, we're sorry. And they started a whole campaign around you don't have to grin and bear it. So it was kind of fun and playful, and it worked very well in their culture. And it really helped turn it around. And again, they had the numbers to show kind of where they were before and after. And I think for anybody who's starting to do this, get a baseline so that you can actually understand if you're truly making positive change.
I think that's great. Does anybody else want to weigh in on this topic? Okay, then we will move on to to Kim. Kim, in your experience, what have been things that have helped you implement better programs from an equity, diversity, and inclusion perspective?
Hi, I'm sorry, I was muted there. Thanks for having me, first of all, and the graphic looks much better than my picture, so you guys can focus on that. But I think my experience started way early. I would say back when I was 8 years old, my mom was diagnosed with metastatic breast cancer. And years later, working on the administrative side of hematology oncology, I noticed that there were quite a few minorities that were diagnosed in the latter stages of cancer. And during that time, I was in graduate school, and I decided to do my thesis on why some women, especially minority women, were diagnosed with the latter stages of breast cancer, and found out that a lot of it was due to women working 2 and 3 jobs sometimes, or being the single mom, or working to just provide for their children or husbands, and paying more attention to the health of others versus themselves. So a lot that just stayed on my mind for a long time. And as an HR director, I try and focus on total wellness in the workplace and kind of the equity of thought when it comes to wellness and well-being, whether it's women, minorities, men, etc., but really focusing on issues that may affect the minority population a little bit more, creating awareness. And I agree with Lynette and other panel members that education is key, making sure that our staff, they understand their benefits and what I call the benefit of their benefits, and to focus on the various months of awareness, whether it's heart, breast cancer, mental health, and putting on programs that will offer continuing education for the masses of staff and employees that we have, and so that they can take it back to their extended family and ensure that we are really dispersing that education accordingly and giving people some time. You know, we spend so much time in the workplace. Making that education piece and awareness available to all will help us all in the long run, whether it's a diversity and inclusion effort, equity issue, et cetera. Education is key to spread that knowledge.
I totally agree about giving people the time. I know when we implement programs at Thrive Global, we always want leadership to lead, because if people don't feel like they can take time for themselves, they just feel like it's lip service. And I think sometimes it even makes the problems worse. So you need people to stand up and say, we are giving you not only this great program, but the time to truly use it. But thank you for all of that information, Kimberly. Is there other people that want to weigh in on how they're addressing this in programs that have been particularly successful or not successful in their organizations?
Yeah, you know what? I'll talk about this because I was actually just in a group called Women in Tech, or Women Who Tech. And we were just talking about the lack of diversity in leadership within the tech industry. As a matter of fact, we were just talking about, for the second year in a row, that only 2.2% of investment funding is going to women-led startups. So taking that into account, we are seeing that people at these larger companies are doing these pledges, but they're not actually acting on them. So I just thought it was really interesting that you said also taking the time to do it. It's like, are we going to now be able to go, okay, we took this pledge, but we're also going to back it up and give women funding so that they can lead truly and create these cultures where leadership, women leadership, is finally giving their due. And starting with funding. We can't be able, we can't build these things. We can't build and talk about diversity and equity if we're only doing what you said, which is lip service and saying, yes, I pledge to diversity, but I'm not actually going to give you any funding.
Well,
Go on,
I was going to say, that's kind of interesting. There was a great research article, the research project that came out of Columbia a couple years ago that directly ties pay equity to depression and anxiety for women. And so it's this thing about, it's that bigger picture again, saying these things are interconnected. And if you're just focusing on this little piece, or we're going to do a program on just this little piece or just this little piece, without understanding how they're interconnected, this is some of the myths and why we haven't moved some of this forward. It's, we're going to solve for this one little tiny problem. And I think we all want these instant answers, right? It's easier. We're all busy. We're crazy. We want something that's going to be a solution. But from our perspective at Global Women for Wellbeing, you wouldn't think that heart surgery would be simple, and neither is this. I don't really want to go to a heart surgeon that said, you know what, I'm going to take care of this in 15 minutes. We can get this done. It's been one of the misses around this diversity discussion, I think. And I think that we're now in a world where we have real opportunity. There's a lot of noise again, and that's good. But I think it shows that a lot of the stuff that we've tried to do and talked about over the past 20 years has not worked particularly well. And so it's an opportunity for us collectively to now say we need to take a different direction and we need to measure results.
100%. There's a great quote by Bill Bernbach that a principle is nothing till it costs you money. And I think in this case, it's money, but it's also time. Because I went to a women's college about 1 million years ago, and we're still having these same conversations, and the numbers have creeped up, but they haven't gone up that much. So I guess it's heartening that they're going up, but it's disheartening that they're not growing by leaps and bounds. Jen, do you want to weigh in on that?
No, nothing further to add on that.
Right. So to you, Mim, as working women, I guess to you and all of us, how are you managing your work life in a way that's conducive to good mental health?
Well, I do personally try and walk the talk. I did work for National Financial Partners for many years and did a lot of benefits design and health prevention design. And then I sat on site at Goldman Sachs under the Altum umbrella and ran some of their program strategy. So I have truly worked on Wall Street before that. And at that time, I can tell you that not everything I did supported my health and well-being. Since that time, I truly have made a concerted effort. And it is, it's the basics. I get enough sleep. Ask my husband, I'm a stickler about that. there is so much science to show you need to get 7 to 8 hours of sleep. I mean, that's the way this works best. Eating healthy, making sure I have good social connection, which is important. If you're on the road or you're a consultant, or even if you're a woman that's at the top of your organization and there's not a lot of other women or people that you feel like you can relate to, social connection is so key to your mental health and well-being. And I also just want to say that for me, I was the primary caretaker for my father at the end of his life. And I am deeply grateful to this incredible network of support through Global Women for Wellbeing. These were the women that were calling me up. You know, it was, are you okay? What can I do for you? And I think that that's the kind of thing more than anything. We're going to slip here and there. We all have busy lives, but that social connection, that connection to people that truly have your back and understand where you're coming from is so key for any leader at any part of their career.
I totally agree. Kim? Can you
Yes. Well, I agree that just having those connections in the workplace and outside of the workplace, that's why we try and build some focus groups, for instance, for new moms that are coming in and haven't, experienced balancing work and family. And sometimes it causes some anguish. And we try to just build some target groups for people that have either reached out or provided us some feedback that they wanted to see more of this topic or that topic. We try to be as responsive as possible. And in leadership, I think I shared with this group before that being a minority in executive leadership, that's definitely a tough situation. And when you walk into a room and you're the only one represented there, and trying to build those bridges and almost prove your worth, that's just tough mentally. So years of that has really strengthened me to even help others and pull others up, women and minorities in particular, to help them have that seat at the table and be comfortable. So again, education, leadership, reaching out, and having a strong network is key.
Got it. Lynn or Jen?
Yeah, sure. You know what? Sometimes when I think about balance, I typically always get an image of a scale. And I feel as though that's actually, for me, that's not the most accurate thing to think about with balance, because it's very linear, it's up or down. Where instead, I think of things in the realm of a circle. And my life is broken down into slices. So I feel as though when a slice is off, if I'm eating a slice, that means I'm nurturing that particular slice of my life, whether that be personal, social, financial, physical, or spiritual, which are all very important to me for me to have balance. So when I notice that one particular slice, and for me, I have 6 slices, when one particular slice is off key, then that means it's time for me to nurture that one. And for me, that's how I try to more so than balance, but try to have a whole life. And a whole life does not necessarily mean that things are weighed even. It means that I'm making sure that I nurture every single slice of that life, whether sometimes it's more than another or less than another. So, in a personal one, that might look like me journaling, because sometimes we think, oh, I have to do this really extravagant thing. But just journaling and documenting and getting out of my head is something that's really important to me. Me going to my martial arts class on Sunday so that I can get my physical exercise in, because the whole thought of going to the gym makes me just want to just no. But I'm willing to go to my martial arts class. So that helps keep me in shape, but also that helps nurture my social, because now I'm forced to go into social circumstances and learn these different techniques and be mindful of how I am, so I don't accidentally cut somebody off with my sword. But so for me, it's just about taking a look at all the different aspects of my life and making sure that I'm eating all the pies of my life, so that there's happiness and joy and wholeness in my life, not necessarily this weight of up and down.
I love your gym story and the sort of life hacks at Thrive we call the micro steps. Like really, you might not be running a marathon tomorrow. What's the little thing that you can do that's too small to fail that keeps you on track? Whether it's sleep or it's having that moment of gratitude. I think that those are super important. Does anybody else have any other life hacks to share? I'm always looking for a good one. I'm not going to go to martial arts class. That will be bad. But I'll take other life hacks.
So
Hi,
a great
this is Kim. Oh, sorry.
No, this is Jen. A great life hack that it's actually not my own life hack, but it came from my boss, and I think it's a great one. However, I have failed so far to implement it. But when he's on an airplane, I travel a lot, as do many folks at Deloitte. But when he's on an airplane, he refuses to log on to in-flight Wi-Fi, and he uses that time to meditate, to read, to journal, just to rest, reflect, or think. And so I think I'm probably I get that done about 2 out of every 10 flights, but I'm trying. It's in process.
I would highly recommend it.
Yeah, it's the best thing about going someplace where there's no Wi-Fi on the plane.
Yeah.
That makes it fun. Any other life hacks that other people can use?
I recently purchased a steamer, like a personal steamer, and it's just good for you to just sit in there, let the toxins out, meditate, think about your day, etc. It's not an expensive purchase, but it's definitely worth it. I learned that from my aunt who's still around and she's 92. And so she exercises still every day. And we used to steam when I was younger. And she taught me that just good for your skin and putting some essential oils in there and really taking that time to relax. So I'm glad to have gotten back into it. I used to be on the road quite a bit as well. So that works out well for me.
I love it. I thought that you were first telling us that we should buy a steamer and cut down on dry cleaning, which I would probably also agree with.
Well,
that works too.
I can't stop thinking about eating pizza. Although Lynette was talking about pies and she kept saying peace, and I kept thinking pizza because I love pizza.
Well, I would say the one other thing that, at least for me, is being in nature and making sure that I get outside. I just think I'm very geeky about like evolutionary biology, and I just know that this is built to be outside. And so when I do work from home, I'm lucky enough to live in a wooded area. I make myself get out multiple times a day, even if it's just 5 minutes between calls. Even in the city, I used to go out and really try to push the team to do walking meetings. It just makes a huge difference. And it's such a tiny thing if you can build that into your schedule. But plenty of science to support being outside is very, very good for your mental health and well-being.
Definitely. And I also think it's important to share these tips. I mean, we'll do a lot of work with companies and people will say, oh, everyone has to stay until 10 o'clock at night. And then you'll hear that's not necessarily really true. People have created life hacks that make it work, but they're too afraid to share. And once you hear how other people do it, it builds that camaraderie. And if we're not going to support each other, who is? So I think it's really helpful that people share valuable tips that help them, thrive in all aspects of their life or their pie, because that's what helps.
And to have intentional safe spaces for them to feel safe enough to share.
Yes.
Somebody mentioned that peer support, and that's so important, whether you're a solo entrepreneur such as myself, although I do have a small team, or you are a small business owner to a larger business owner, to have these different types of peer support groups. I know in larger corporations, they usually have affinity groups, but for us, who are entrepreneurs or small business owners, we have meetups that now are offering these type of peer support groups. One of my colleagues just started a whole program offering to help people match so that they can have peer support groups in alignment with where they were in their career levels, which I think is a fantastic idea.
Yeah, that's fantastic. So we are not yet at time, Jenny. I don't know if you want us to dig back into other questions.
You know what? I think this has just been such a robust conversation, and each one of you has really delivered impactful key takeaways from thinking of your life as a whole high, and balancing that not on a linear basis, but in a circular basis. I love that. And I think, also talking about journaling and providing affinity groups and meetup groups within your organization, and having the meetup groups be diverse enough so you have men and women at the table talking about these different conversations, and giving the time, just to summarize that. And then also men, like the simplest things, a walk and talk meeting outside. I mean, I know you do this because when we've had conference calls, I can hear birds chirping and I can hear you outside, and it's refreshing. It really is. And I think employers can do this. And that's these little key takeaways. So maybe they may not have the budget at this point to, bring in a huge program, but all of these small key takeaways can be used to make a difference in women's life, men's life, everyone's life, and make people more inclusive. And I think from a mental health perspective, Lynette, thank you for sharing, your story, and I like the way that you addressed it. And so all of you have just been great. Each one, Kimberly, Allison, thank you guys so much. We do have, a few minutes of extra time, maybe some final words from each of you before we go. Mim, if you wouldn't mind taking the lead, final word, and we'll go down the line.
Sure. It's not just mental health, it's mental well-being. And I think that it's really important to kind of differentiate between those two things. If you have a medical issue, I cannot encourage you enough to go and get support. If you wouldn't walk around on a broken leg, please go get the help that you need. Reach out to people. But from a mental well-being perspective, I think that we are really at a point where we have an opportunity to start to reshape this conversation so that the next generation of young women and men coming up can have a better dialogue, can have an opportunity to provide workspaces where both men and women from all backgrounds can be at their best. But it is going to take more research. It is going to take really good minds, diverse minds coming together. And it's going to take a little experimentation. But we need this. We need more empowered, healthy leadership, mental, physical, for us to have a more sustainable world. It is, in my mind, an imperative. And it is why I am so passionate about the work that we do. And would invite anybody who wants to learn more about what we're doing, or be a part of that conversation with us, or has something to share, research that we can pass on. We welcome the connection, and we're also happy to pass on anything that can potentially help you.
Thank you. Allison, would you have some final parting words?
I love what you said about not only supporting women in this journey, but making sure that men are our partners as well. As the mother of 3 adult boys, and today's my 25th anniversary with my husband, men need to be partners. Partners with us in this. And I think it's really important that we support each other as women, and then make sure that we have men support us in the journey. It's the only way we're going to get there. Great.
Lynette, final words from you?
Yeah, you know what? It's because right now, because it's Mental Health Awareness Month, and I'm actually doing this campaign called Entrepreneurs Talk About It. So that's going to be my thing. Don't be afraid to talk about it. We can't begin to decrease stigma or crush the stigma unless we open up and be able to talk about it the same way we would be able to talk about any other topic. If we don't feel comfortable talking about it, if we don't get ourselves out there, then more and more people are going to continue to hide. They're going to hide behind their computer screens. They're going to hide behind their work as busy work. And they're not going to tend to their mental health because they feel as though they can handle it by themselves. And that's one of the reasons why we have such a huge loneliness epidemic going on in this country right now. So reach out, talk to people. Don't be ashamed of all of who you are. Love all of who you are, and talk.
Thank you, Lynette. How about Kimberly? Final words, Kimberly?
Sure. Just give yourself and others the permission to recalibrate mind, body, soul, and spirit, and support that and celebrate well-being in a total form.